Awesome. Good afternoon, everybody. My name is Andrea Strohmeyer. I am a science educator for the Health Museum. I'm honored to have you all here for today's virtual program, Cancer Symptoms Women Shouldn't Ignore, taking place in partnership with University of Texas MD Anderson's Cancer Center. A few housekeeping things. You are welcome to submit a question at any point during today's program. The Q&A box is located at the bottom of your Zoom window. Today's program is recorded. You are welcome to have your videos on or off. If you don't wish to have your video in the recording, you are welcome to turn that off. We are going to ask everybody to remain on mute so that we don't accidentally talk over our speaker. Today's guest is Sylvia Brown, M.S.N. RN. She is a nurse navigator in the Cancer Prevention Center at MD Anderson. She delivers cancer education and prevention presentations throughout the greater Houston area. Sylvia graduated from the University of Texas's Health Science Center, located in Houston, with a degree in nursing and a master's degree in nursing from Texas Women's University. And today we also have Miss Angela Belcher. She is with MD Anderson, and she is going to be monitoring the Q&A session.
Thank you so much. Thank you for having us today. We are so excited to be presenting to you on cancer symptoms women shouldn't ignore. And this is a very important topic because there are subtle things that we need to identify and be aware of that could be cancer. Now, everything we talk about today, you may have experienced at some time or another. That doesn't mean that it's cancer, but it means that you should be aware of it and discuss these things with your physician. So we're excited to get started. I just want to mention, obviously, I'm working from home today, so I'm not wearing a mask, but at MD Anderson, we are very cautious and have taken all steps to make sure we protect our patients from COVID. So typically we would wear a mask. And also, this is an interactive presentation, so there may be opportunity for you to answer questions through Zoom, so you can click on your reaction button and give a thumbs up for the questions. Just wanted to let you know that. So let's get started. So we just want to have a slide here about stopping the spread of COVID. I'm sure you guys are all already aware. You want to stay 6 feet apart. You want to social distance. Wash your hands. That's very important. So washing your hands for 20 seconds, washing with soap and water, and rinsing and drying. And then wear a mask when necessitated or needed. And then if you are exhibiting symptoms of COVID, get tested. I've actually had to test myself 6 times and always negative. But if you're exhibiting the symptoms, there are multiple avenues to get tested. So let's get started. So breast cancer is the most common cancer in women. It is the #2 cause of death behind lung cancer. Approximately 266,000 women will be diagnosed with breast cancer each year. And nearly a third of all cancers diagnosed in women are breast cancer. Now, one thing that we don't think about is that men also can get breast cancer, about 1%. However, with men, they tend to ignore if they felt, something in the chest area, and it's typically found at a later stage. So just be aware and educate the men of your life about that possibility. So a little anatomy lesson for you guys today about the female reproductive system. So we have 2 ovaries, and they're connected by the uterus and the fallopian tubes. As you can see on the slide there, the cervix and also the uterus. So the cervix is part of the bottom of the uterus and connects to the vagina and the uterus, or the birth canal, it's also called. So here's a little question for you guys. So click the button if you think endometrial cancer is the most frequently diagnosed cancer of the female reproductive system. I won't be able to see, but it is true. The endometrial cancer is the most common cancer of the female reproductive system. It is, I'm sorry, I just have to move something real quick. So of all the cancers, it's the 4th most common and the 6th most deadly in women. So there's a lot of signs and symptoms we're going to go over today that you may or may not have experienced that could be a sign. So we hope today to educate you and give you these signs. And again, not to scare anyone, not to say that you do have cancer, but just to be aware and go get it checked out by your physician. So ovarian cancer is often diagnosed at a later stage. So 4 out of 5 women will be diagnosed at a later time. Why is that? Because there might be subtle signs that the patient has been experiencing for a while, and they're thinking, oh, you know, it's just cramps, or I feel full, it's going to be fine. And then we ignore those symptoms. So it's important to be diagnosed early, so at a treatable place, and before it gets metastasized or spread. It also can spread typically through the abdomen, so we want to catch up way before it gets to that point. Cervical cancer rates are on the decline, and there's several reasons why. One is the Pap test. We've had that for years, and that will detect cervical cancer, or importantly, abnormal cells that we can do something about before it turns into cancer. And then as more men and women get the HPV vaccine, it's decreasing those rates of the HPV infection, which leads to cervical cancer. So that's another reason that we have seen a decline in cervical cancer rates. So cancers of the reproductive system account for about 15% of cancers diagnosed in women. So as you can see there on the slide, that's not a whole lot. So about 110,000 women will be diagnosed with one of these cancers of the reproductive system this year. So it's important to know the warning signs. Again, these are very subtle signs, and I hope to educate you today just to be aware and to reduce your risk. And we'll go over some things that you can do to reduce your risk of these cancers as well. So let's go over some of the warning signs and symptoms that you should be aware of and that you should consult your physician if you're experiencing. So having one or more of the following symptoms for 2 or more weeks may not necessarily mean you have cancer, but it could be a symptom, and it's best to discuss with your doctor and make sure that you rule out any type of cancer. And I know with COVID, it has kind of deterred people from going to get screenings and going to the doctor. But I do know that clinics are being safe, having you wear a mask and taking precautions. I know at least at MD Anderson, we are doing extensive cleaning and taking extra precautions to make sure everybody's safe. Okay, irregular bleeding. So more than 90% of women diagnosed with uterine cancer have some type of irregular vaginal bleeding. So if you have gone through menopause already and then start to have bleeding, that is not normal. It is abnormal and needs to be investigated and assessed by your physician. If you haven't gone through menopause and you have irregular bleeding, so bleeding between your periods, heavy bleeding, you have to know what's normal for you, and then that will help you know when it's abnormal. So that's the key here, is knowing what's normal, and then when you experience something that isn't, going and having that checked out. Because irregular bleeding can be signs of cervical or vaginal cancer, and something we definitely don't want to ignore. Unexplained weight loss. So let me clarify this. So if you have suddenly over a few weeks have lost more than 10 pounds without trying, without changing your eating or without exercising, then that is something that needs to be checked out as well. Cancer is very rapidly divided cells. And so that kind of raises your metabolism and can cause weight loss. But if you're currently overweight and you're trying to exercise and you're making healthier choices and you're eating right and you've lost weight, then of course that's not a concern, and it actually can help lower your risk of cancer. And we're going to talk a little bit more about that. So the key here is the unintended or sudden weight loss. That's really what we need to be aware of. A lot of patients that come in with a cancer diagnosis will state that, you know, I've been tired for a while. And that brings us to the constant fatigue. If you're feeling constantly exhausted, no matter how much rest you get, no matter how much sleep you get at night, you're just extremely fatigued and just feel like you cannot go about your personal duties or your work life, then that is something that needs to be brought to a doctor's attention. Now, we're all tired. We're all busy. We're busy moms. We have busy careers. And so we definitely all experience fatigue at some time or another. But we are talking about just this extreme fatigue that you just absolutely can't shake. And as I stated, just no matter how much rest you get, you can't feel energized again. So that's something to make sure you bring to your doctor's attention. Appetite changes. So if you're feeling full, so if you take a couple of bites and you're feeling full, or you're really not hungry at all, that could be a symptom of ovarian, or there's other types of cancer such as stomach or pancreas or colon. You maybe think, oh, this is great. I'm not eating as much. I'm not as hungry, but it could be a sign of something more. So just important to get checked out by your physician. Pain and discomfort. A lot of patients that come in with the ovarian or pancreatic or some types of cancers will say, you know, I've just felt bloated for a while. My stomach's been hurting, and I just have this ongoing pain in my stomach. So if you have that ongoing abdominal pain, discomfort, this could include gas, indigestion, like I stated, that pressure, bloating, cramps. It could be a sign of ovarian cancer, and a lot of patients will ignore this. So it's definitely something you want to bring to your doctor's attention and have assessed. Persistent indigestion or nausea can also be a sign of certain types of gynecologic and other cancers. And then constant pelvic or pain or pressure can mean uterine. So again, if you're experiencing these, that doesn't mean that you have cancer. This is not to scare anyone. This is just to provide information and education for you to be aware of, to catch things early whenever we can treat it. Changes in bathroom habits are also very important. So if you're needing to use the bathroom more frequently or feeling constant pressure on your bladder, it could be a sign of cancer. Now, also could be a sign of maybe a bladder infection or something like that. So again, just know it's not normal and have it assessed. But if you have decided you need to drink more water, and or even if you're pregnant, you'll go to the bathroom more frequently. So that's not necessarily a concern. Also, a change in bowel habits. It could be a sign of some types of gynecologic cancers like ovarian and cervical and endometrial. But also this could be a sign or symptom of colon cancer. So again, really important to do the screenings that are recommended and to bring any of these signs or symptoms up to your physician. Sometimes they'll do certain tests, but it's important for you to check that out. So a breast lump. So many women think that the only sign or symptom of breast cancer is finding a lump. So we really educate. We want our patients to be familiar with our body. We want to know what normal feels like. We want you to know what normal looks like. So a lump, a thickening, or a hard knot or swelling in your breast or armpit could be a reason for concern, and definitely you want to check it out. Now here's a question for you guys. So click the button if you think that a breast lump is the only warning sign of breast cancer. The answer is false. Hopefully you did a thumbs down. It's false. There are many signs and symptoms. I know that we educate that if you find something, yes, you need to have it checked out. That doesn't mean that every breast lump is cancer. It just means that you need to get it checked out. You could also experience certain breast changes. So redness, a lump in the breast that you may see in the outside or that you may feel inside. Swelling, maybe one breast is a little bit larger than the other. You just notice that there's a change in size. A lump in the armpit also can be a sign or symptom. And then that orange peel texture, so finding or seeing dimpling on the outside, or the dimpling just like kind of a concave area, that all could be signs or symptoms. I do want to take just a moment here to educate you a little bit about the COVID vaccine. So what we're seeing is some women that have had the COVID vaccine on that effective arm may come in and we may do their screening mammogram, and we may see an enlarged lymph node. That does not mean there's breast cancer there. That just means that your immune system is working and it is creating immunity. And sometimes a lymph node will swell because of that. It usually resolves. So we recommend waiting to have that screening mammogram 4 to 6 weeks after the COVID vaccine so that we can avoid that. And we have seen it. So we just wanted to give you a little bit of education there on that. Also, some signs and symptoms of breast cancer are nipple changes. You could have a nipple discharge or an inverted nipple pulling in. Could be a change in direction. Could be an ulcerated area on the nipple or some scaliness. A lot of women call us and say, you know, I'm having nipple discharge. This doesn't necessarily mean it is cancer. Could be something else benign, but definitely something that you want to investigate. A lot of times they'll send off, we can get the discharge, we'll send it off and test the cells. So that's something to be aware of too. Now, if you're a lactating mom and you have quit breastfeeding and then continue, I mean, it's just something to be aware of and to get checked out if it hasn't resolved. Again, knowing what is normal and what is abnormal for your body is the key here. So let's go over some things that you can do. So finding cancer early is the key when it's most treatable. And it's really important to have the recommended screenings done so that if there is something, we can catch it early. I know, again, as I mentioned, that a lot of patients have been afraid to go in for screenings and things like that because of COVID. But again, at MD Anderson, we have taken extreme precautions and we are making sure that we protect our patients. So don't let COVID scare you for not getting your routine mammogram or any screening for that. So yes, starting at age 40, we recommend, and also the American Cancer Society recommend that you start your mammograms at age 40. Also clinical breast exams, you should have that starting at age 25 on a yearly basis. And then you should be aware. So again, we want breast awareness. What is normal, what looks normal, what feels normal, because that's when you're going to notice all those subtle changes and catch things early. Now, women with specific medical or genetic, so if you have a family history, you may need more frequent screening. And at MD Anderson, you can come in to one of our providers and our specialists. They will go over your family and personal history with you, and they will determine if you may need more frequent screening. Sometimes ladies that are at high risk will get screenings twice a year. They'll alternate a screening mammogram with an MRI, and that's something that our specialists can help you with if you're not sure. Get a Pap and an Hpv test. This is important. So women ages 21 to 29 should have a Pap test every 3 years. Women ages 30 to 64 should have a Pap and a Hpv test, so the human papillomavirus test every 5 years. And then women without an Hpv test should, again, do that every 3 years. So women 65 and older, they don't necessarily recommend this screening. However, this is a discussion to have with your physician because maybe that's something that you need to have if you've had certain things happen in your history. So talk to your primary care physician, or if you would like to come into our cancer prevention, you can talk to one of our specialists about that, and they will be able to help you determine what's best for you. Okay, click your button if you think all women should get tests for uterine and ovarian cancers. So only women at an increased risk for uterine and ovarian cancers need to get the screenings for these. So this includes women that may have a history of Lynch syndrome. They should have a biopsy of the uterus and a CA-125, so that's the test for ovarian cancer. And then they recommend an ultrasound every 6 to 12 months to look for uterine and ovarian cancers. And then I'm sure you've heard about the BRCA1 and 2 mutations. So this could lead to some uterine, ovarian cancers, and also breast. You may have remembered that Angelina Jolie years ago, I think she had tested positive and had double mastectomies and hysterectomies. So This is something you should be aware of. And if you've had, a mom or someone that has tested positive, a sister, this is something that you may want to check out, and you may need to have higher risk screening. So again, it's important to discuss this with your physician and make sure that you determine the best treatment and plan for yourself. So the HPV vaccine, we have mentioned that already. So HPV infection can lead to cervical and other cancers, and we have definitely seen a rise from HPV cancers, but now with the vaccine on board, as we mentioned with the cervical, we're seeing a decline. But about 80% of men and women will be infected with HPV virus at some point in their life. So we have the vaccine. The ideal time is to have a boy or a girl receive the vaccine around ages 11 to 12. And that way that gives their bodies time to build up the immunity. You can continue to get it till age 45, but optimal time is between 11 and 12. HPV and related cancers include cervical, vulvar, vaginal, C.N.L, anal, throat cancer. So important to talk to your doctor, see if this is something that's right for you, and consider getting the vaccine if you haven't already. Maintaining a healthy weight, and this is really hard as we age. This is one of the things that I find as I age a struggle, but it's important. So being overweight and obese can increase your risk for breast, ovarian, and uterine cancers because visceral fat, like especially women around the abdomen, it surrounds your organs and causes inflammation. And that inflammation can cause your hormone cells to divide more than usual, more rapidly, which can lead to forming tumors. So be active. That is really the key here, eating healthy, a plant-based diet as much as possible, and staying active. So the first step is to sit less. And that's really hard to do right now during COVID. A lot of us are working from home. A lot of us are sitting at our desk all day. One of the things I try to do is get up and walk, be aware, my office is upstairs, so I try to walk down, get up and move just a little bit throughout the day. So the goal is 150 minutes of moderate exercise and 75 minutes of vigorous physical activity each week. So just get to moving, take a walk. It's nice outside right now. Also, the other thing that's important is lifting weights, so strength training. That is important because as we age, our bodies lose muscle. And for women, especially us that have gone through menopause or going through menopause, our bones tend to lose calcium, and that can lead to osteoporosis. So something that you want to be trying to incorporate in your exercise routine at least twice a week. We want to limit alcohol. So even a small amount of alcohol can increase your chances of cancer. So for women, it's 1 drink per day. And that means 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of liquor is the serving size that's recommended. And also, there's a lot of extra calories in alcohol, so that can lead to weight gain. So just something to be aware of, and maybe try a non-alcoholic drink. Avoid tobacco and vaping. So vaping is very popular, especially with the younger generation. So quitting smoking can lower your risk of many cancers, including cervical cancer. I know with smoking, it's related to lung cancer, but it is also related to other cancers. So just 20 minutes after your last cigarette, your body starts to heal itself. And so working to quit smoking, and at MD Anderson, we have smoking cessation classes that could help you with that. A lot of people think that e-cigarettes are an alternative. It's not. They actually contain a lot of nicotine and is not an alternative for quitting smoking, but we do have other things that we can help you with if you need help. So know your family history. Actually, most cancers are not hereditary, but if you do have a family member that has had cancer, it could mean that you're an increased risk. So this is something to talk to your family doctor about and gain that history. And so they can determine if you need more frequent screenings, or maybe you need to see a genetic counselor. And we do have genetic counseling and testing at MD Anderson, and they can help you with that. So we have discussed today many avenues to reduce the risk of cancer, signs and symptoms to be aware of. And hopefully it's given you a good overview of what's subtle and that you can talk to your physician about. But at MD Anderson, we're here to help you from the entire spectrum. So from cancer prevention all the way into survivorship. We have an extensive survivorship program that can help if you have had cancer, and we have a great prevention program. We have healthy living that can help with weight. We have smoking cessation. We have all types of screenings, breast, well woman visits, colonoscopy screenings, all of those things to help you. Also, if you have experienced a breast problem, or if I've been talking to you today and you think, oh, I've experienced that, we have what's called an undiagnosed breast clinic at MD Anderson, and that's actually the area that I work in. So any woman that finds a lump, or maybe you've had an abnormal screening mammogram, we can bring you into our clinic and see one of our specialists. You'll get same-day diagnostic imaging with results. So it's a comprehensive visit, and everything happens in one day, and you leave with results. Except if you needed a biopsy, then that would return in a few days later, but at least you would have your imaging results that day. So the key elements are here is just being aware, getting your screenings done, and just making sure you're aware of the signs and symptoms that may lead to certain types of cancer. That is it for my presentation today. The next slide gives you a phone number, and I think Angela is going to share my email address with you guys. I am happy to answer questions right now, but also you can contact me at a later date. And again, Angela will share that contact information with you. I am always happy to answer your questions, talk to you about something you may be experiencing, and getting you to the right arena and area for care. Thank you so much for having me today.
Thank you, Sylvia. I think we have 2 questions in the chat, if you don't mind answering.
Sure.
Our first question is, are certain cancers hereditary in females?
Yes, there are certain cancers, but only about 5 to 10% of cancers are familial. One is breast cancer. I mentioned the BRCA1, BRCA2 gene, and there actually is a whole list, an algorithm that we have of different types of genes that can mean hereditary cancers. And there are some genes that lead to colon cancer that can be hereditary. So the answer to that question is actually very extensive, but yes, there are definitely different types of genes that can lead to cancer and be familial.
Great, thank you. Okay, our second question is, if you have had HPV and you've been treated, are you still at risk?
So it's my understanding that the virus remains. However, it can be in a dormant phase. So to answer that question personally, I think that's something you need to talk with your physician about, just because I don't know the entire history of what you've had, how you've been treated. So I feel like that is something you need to discuss with your physician for sure. Or you can come to us and you meet with one of our specialists, and they can review your history, and we can give you more determination that way.
Okay, we have another question. The question is there a current recommendation for women who have not received their HPV vaccine if they are under the age of 45? If so, why do we not have a bigger push for this?
I'm sorry, I didn't hear the second part. If so,
if so, why do we not have a bigger push for this?
I'm not sure, Angela, the second part, you're muffled. So as far as the HPV vaccine goes, if you have not had it, then the recommendation, let me see if I can go back to that slide, but the recommendation is for you to have, be tested for the HPV virus. And that will be done through your Pap smear. So you would want to, if you're younger, you have the vaccine, or excuse me, you have the screenings every 3 years, and I believe the HPV with the Pap is every 5 years.
All right. Do we have any other questions from anyone? If not, I think that's all the questions that I see, Sylvia.
Okay, well, thank you so much for having us today. We really appreciate it, and hopefully we've been able to share some good information with you guys.
Thank you so much, Sylvia and Angela, for being on today. Thank you, attendees, for joining us today. We have really enjoyed this presentation. For information about our other upcoming events, please visit our website and check us out on social media. This Thursday, our virtual series, Parents, Let's Talk About Mental Health with the Menninger Clinic, begins with Beyond COVID, coping with reentry into the community.
Thank you so much. Have a good day.
Thank you. Have a wonderful day.